Hello, 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 and welcome. We welcome you to yet another broadcast of Pain in the Pews Mental Health and Ministry. I am Chelselia Cookie Payne, founder of PAYNE Glory Incorporated, and I'm so happy to have you guys here with us on tonight. Go ahead as you're with us on tonight. Go ahead and hit that share button. You're going to be glad that you did because listen, we've got a phenomenal guest with us on tonight. So thank you guys who are already jumping on and being a part of us. Go ahead and share. Let us know where you're viewing from and all that fun stuff because we're glad that you're here. Hello, Cheryl. Thank you for being with us. I see that you are one of the first ones that's on, so I'm just happy to see you with us. And all those that are joining on that I can't see your name. Again, my name is Chelselia Cookie Payne, founder of PAYNE Glory Incorporated, and this particular broadcast and ministry, which is Pain in the Pews, Mental Health and Ministry. We strive as an organization to bring empowerment, to bring strength, to bring hope, and we encompass that by bringing great dynamic guests on every Monday night with our Facebook Live broadcast, as well as events that we host throughout the year. This night is no different. This night is no different. And so as you're coming on, we encourage you, go ahead and get comfortable. Go ahead. You might even want to take notes. You might even want to get prepared to get some knowledge and inspiration. You want to get prepared for what we're going to receive on tonight. We are honored for this opportunity. Pain in the Pews Mental Health and Ministry is all about mind, body, and spirit. We don't want to leave out any part of the human experience. And in doing so, we want to bring clarity, we want to bring hope, we want to bring information. And so that's why we bring on every week, 7 o'clock p.m., some of the most amazing guest speakers. And so tonight is no different. And I'm so excited about it. So before we get started, I do want to let you guys know in the promo, you heard me mention that I was going to have, hey, Melanie. So Melanie Williams says, hey, Tangie. So you may have said that, you might have seen or heard that I said that at the end, I'm going to be sharing something that may be a little controversial. Well, I'm going to share that at a different time. It's still a topic of discussion. It's still actually dealing with the nursing profession and it's still dealing with COVID-19. But because I was unable to acquire it to show it to you on tonight, I will be showing it to you at a different time. But this time right now is going to be dedicated all about a view from a nurse's station. Listen, this is going to be a powerful discussion. So as you're coming on, please feel free to go ahead and share. And if you have questions, I will be monitoring. You'll see me turning here to my right. I'll be monitoring Facebook just to kind of see if there are any questions. So let me get right into it. Let me introduce to you who we have with us on tonight, which I'm super excited about. We have with us Tangie Henry. She has been a registered nurse for 15 years. She is certified in inpatient obstetric nursing and is passionate about women's health. Her current assignment consists of caring for pregnant and or postpartum women diagnosed with COVID-19. Let me reread that for you, just real quick. Hello, Adrian. We're glad that you're here. Hello, Minister Johnson. We're glad that you're here. Let me reread that last part. We know from what I just said that she's passionate about women's health, but let me tell you why, let me tell you a component of that passion. Her current assignment consists of caring for pregnant and or postpartum women diagnosed with COVID-19. Additionally, she is a certified life coach who inspires women to live whole, healthy lives from the inside out. Ladies and gentlemen, I am pleased to share with you all Tangie Henry. Thank you so much for joining with us.
Thank you so much. I am super honored. Thank you so much.
It is my pleasure. It is my pleasure. I'm going to give the opportunity for you in just a moment, in just a little bit, to tell us a little about Inspired Sister, which is actually how I actually first found out about you. But let's dive in really quickly.
Okay.
Because I have some questions that I have for you. And if you see me moving, I'm trying to actually access my charger because my laptop says that we're about to we're not to
Oh.
be. But listen, Tangie, as I'm getting this just plugged in real quick.
Okay.
So tell us, because you and I talked off screen just a moment ago.
Mm-hmm.
Tell us about the ward. I don't know if ward is a proper term that I would use, but the department that you work in.
Yes. So I work in a department where we're considered, where we work with moms who have concerns before or after their pregnancy, with either them or their babies, and they're considered high risk in their pregnancy. And so since the pandemic started, my unit in particular has been slated to be a cohort unit for women who are pregnant or recently delivered who have been diagnosed with COVID-19. So it's kind of a unique experience in that these women are, we're concerned with not just them, but also their babies or how their body is responding after being recently delivered.
So here's my question for you. For the women who are coming, who actually have to wind up there, right?
Mm-hmm.
Are they have their doctors said that they need to be there, or did they come in and get tested and they had to stay there? How did they get to you? What makes them come to you?
Okay, so they come to us one of two ways. The simplest way they come to us is part of the standard of the hospital now is that any woman, pregnant woman that's coming in for procedures um, like delivery, has to get tested. It's mandatory testing now. I mean, she can refuse it, but everyone is getting, it's universal testing. And so she's diagnosed incidentally. And so because of that, we take the precautions and then she'll come to us um, after delivery. Another way is that she's actually symptomatic, which is what we saw a lot of initially. And these are women who had progressive shortness of breath and fever and all the symptoms of the coronavirus. And they came in and they were diagnosed at that time, and then they came to us.
Here's the interesting part of what you just said. Let's take coronavirus off the table. Let's say that it wasn't here, right?
Mm-hmm.
And if I'm pregnant, maybe it's my second or third, maybe I already know, swelling of the feet, the whole nine. So I might not even think that that's a symptom.
Right.
I might not even think that shortness of breath because, I'm gaining weight. I'm not, I might not even think that that's a symptom. So
Mm-hmm.
it occurs to me that there potentially are women who are expecting who may be symptomatic and not really know it, or on the flip side, for the ones that come to you, because we've been so educated on it, they're coming to you because they're experiencing these symptoms.
Mm-hmm. And I think really the kind of where we are, because it is a pandemic, is that we're really asking people, including these women, to manage their symptoms at home.
Yeah.
And so if they progress to the point where they're extremely short of breath, and we're talking about not just the kind of winded, ooh, because my belly is big, we're talking about just trying to, we see it as much as just helping her turn into bed, and she begins to desaturate. Her oxygen level does. So we're talking, those are the type of who require oxygen therapy. Those are the type of people that are typically getting hospitalized that are not ready for procedure, or they're spiking fevers that are not resolving because of limited resources, limited personnel. Not every symptomatic person may be admitted into the hospital, and that includes pregnant women. And that's been the whole struggle with managing during this pandemic.
I can only imagine that. That seems like a heavy lift in and of itself. There's so many questions that come to mind. I'm going to tell you as we're going on that you have There's a comment here that's from Melanie Williams, who says that she is an incredible nurse. She's an incredible mentor, and she leads by example. So much love for her. Talking about you. How about
Thanks,
that? I
man.
love it. I love it. I love it. I love it. Greetings to you, Minister Linda Johnson. She said, greetings, women of God. I'm so appreciative of you ladies who are joining in. This is a powerful message.
Thank you.
Listen, this is not just for pregnant and postpartum women. So ladies, please feel free to share this. This is information that we all need. Trust me, this is information we all need. So share, share, share. So when you were talking a moment ago, you talked a moment ago about high risk pregnancies. Um, when and I remember, although this wasn't a pandemic, but I remember the precautions taken. When I had my first child, it was very high risk. Everything was emergency, emergency. My placenta separated, so it was very traumatic. It was very urgent, and so. But what I'm getting to is I was in that particular area with a lot of other women who had various things. I mean, of course, it's maternity ward. So I was in an area where everybody was high risk,
Yes.
for whatever the reason or cause was. So in where you are, you have, everybody's pretty much got the same issue, if for lack of a better word. Everyone has a diagnosis, or please correct me if I'm wrong. I guess a better question would be, does everyone that you see have a diagnosis for COVID-19 in where you
So
are?
our unit is split. So one half of the unit, everyone is diagnosed with COVID-19, regardless of their condition. So we could have a mom whose placenta is tearing away. We call it an abruption. Or we could have a mom in preterm labor, or, you know, her baby, something is going on with her baby. We could have her, but she also has COVID-19. And then on the other side of our unit are the ladies who have those conditions, but they're not diagnosed.
And so in your bio, it also said postpartum. So after they've delivered, they're still there.
Yes. So they come in the hospital, you know, in labor, blah, blah, blah. And then we test them and they're positive for COVID. After delivery, they do all the precautions there during the delivery. And I'm sure we'll get to that. But, and then after that, they come up to my unit and we take care of them in, you know, postpartum, you know, typical postpartum care. Half of them are what we call asymptomatic, and so they're not they're able to maintain their oxygen levels. They're able, you know, they're not spiking fevers and different things like that. And so we just manage them, and just with a little bit of extra precaution.
Got it. So going back, and yes, we'll be getting into more in a moment. But you've given so many nuggets. I just want to go back to one thing you also said is oftentimes they're sent home, or they are asked to manage from home, manage the symptoms. So can you give some examples of what that looks like for them?
Yes, it's the first time I discharged a positive COVID patient, I just kept thinking in my mind, wow, like how many more people out there are like her, you know? And so if we discharge her and she's still pregnant, we ask her to self-isolate. Um, you know, we ask, you know, if she has other children or support system at home, that can she have a designated room where she stays primarily. If she's not able to do that, or even if she is, we ask that she's wearing her mask around other family members, make sure she's doing good hand hygiene, not going out. But as you can imagine, that's very difficult to maintain at home,
At
you
home.
know.
Yeah.
If
You're
she
pregnant.
is, yeah. And if she's delivered, we tell her the same things, but we send her home with her baby.
So I know in situations where the mother has a pre-existing issue, whether it is a sexually transmitted disease or whatever the case may be, oftentimes it passes on to the unborn baby. have you all seen that that is happening with COVID-19, or not so much when the mothers who are diagnosed that they pass it on to the babies?
No, so we have not seen that so far. So far, mom's immunity passes to baby. And so I have not seen any positive babies. They do test a baby after delivery, but I have not heard of any positive babies. So that is a great thing. I think the really super unfortunate thing is that we don't know like the long term. I mean, because in reality, we are sending these babies home with positive moms. So we don't follow them after that point. So I don't know. I'd be interested to know because we know that people are still testing positive 2 and 3 months out. And so, where does that, mom's immunity, I'm not sure the exact time frame, but mom's immunity does not cover the baby the entire time. So like what's happening with these babies?
Right. I totally hear you on that. But the good part of what you just said is that when they deliver, they are not testing positive. And if the mother, to the best of her ability, is able to maintain the safety procedures to the best of her ability, I think that that in and of itself is great because it gives an extra layer of precaution. It gives an extra layer of care. Gives from mother and child, daughter. But so it gives that extra bonding. But what also concerns me is the parents, the mothers who are just fearful, who are fearful, coupled with maybe postpartum depression that sets in because you're afraid. You've been given a diagnosis, pregnant or not. You've been given a diagnosis that could be you could be totally fine, get, self incubate for 14 days, totally fine. And then, you turn on the news and then you like, oh my gosh, oh my gosh.
Yes.
And so it's definitely, I'm certain, a challenge. The title of this segment is A View from the Nurse's Station. And so I'm interested because you said something a moment ago that I read also, and the lack of staff,
Mm-hmm.
the lack of staff. Talk to us about that because nurse. I mean, you guys, the nurses are superheroes. The nurses are the ones that run everything. You run the hospitals. You all run the private practice. Where are the nurses?
So it's been an interesting progression. I've been taking care of these patients for 3 months now. And so when we first started, there were nurses who were, who decided that they did not want to care for the patients. So they quit, or we had some that go out on leave, medical leave. And over the time, we've just kind of seen them, we say, fall off.
Yeah.
Because it's very, very exhausting to care for these patients. So
Is that why the ones that you mentioned at the beginning, the ones who didn't want to care for them, was it out of fear, or was it just because they were COVID-19 patients, or was it just like you just said, it was just too much, or a combination?
I think it was more fear because at the beginning we did not know. And so we went from, yeah, absolutely. And so we went from, at that time too, there was a lot of circulating information about us not, or, about nurses not having the proper protective gear to care for these patients. And it wasn't discussed. It was like, today, this is what we do. And the tomorrow, all of a sudden, we were a cohort unit for these patients and just go forward. And so there was this uncertainty about if we were going to be able to be protected, if there was no guideline, and there still really isn't a guideline of how to care for them. And, it just was a lot of, we felt unsafe, and we felt unsafe, meaning we didn't know about how the virus we were going to be protect ourselves from the virus. And we also felt unprotected from the leadership, in that it was like, we felt like we were being thrown in there. So some nurses off the bat were just like, you know what, I'm not doing this. And so they left. And then we had some that's like, you know what, I'm going to sit it out for a while. So they're on leave. And then we've had some over the course of time that have just been completely burned out, because the message that we're getting is something I had a conversation with this weekend, is like, well, we need you all to dig in. So when I showed up from work on Sunday, it was only 3 of us that came to work, you know,
To
and it was,
have to manage how many patients?
so we end up, well, a total of about 18 patients, but we didn't manage all of them, you
Oh,
know. Yeah,
okay.
but that would have been, you know, and half of those were, not half, but 6 of those were COVID patients.
Okay.
So um, it's not safe. It's against nurse patient ratios. It's not safe for us. It's not safe for the patient. It's just bad. And
Right.
so, you know, we're hearing dig in. We were like, okay, we have dug. So we're 3 months in and we've dug. we
Mm.
need we need some other protocols set in place. And so after, you know, a while that gets weary, some people just like, you know what, I can't do this today, you know, and I have no judgment against any nurse that has to do what she needs to do to take care of herself, you know. I think though we're finally in the reality, or some of us are in the reality, that this is not going away. So
Right. Right.
from the nurse's position, we're pushing and saying this is not going away. So we don't need any more excuses. We don't need any more um, pep talks about digging in. We need you guys to set up some guidelines to make sure that we're properly staffed. And then from the other part of that, this is not going away, is that we as nurses have to decide how we want to move forward, you know, and are we able to withstand the pressure that is required to take care of the patients. So it's a very, very strange season that we're in.
Absolutely, absolutely. Which, because of you saying that, and of course, because this is Pain in the Pews Mental Health and Ministry, I do have to applaud you in the fact that, like you said, whatever a nurse has to do to take care of themselves, no judgment. Because listen, your mental health, your emotional health, your physical health is important, and
Absolutely.
it all ties together. If you're not mentally or emotionally stable, or stable is not the word I want to use, for lack of a better word, that's the one I'll go with right now. But if you are in a high stress situation constantly,
Constantly.
constantly, there has to be a moment where you can just,
Mm-hmm.
you gotta be able to talk to someone, like you said, get some protocols in place, get some things and get some structure.
Mm-hmm.
Structure helps a lot with our mental health. If you get some
Absolutely.
structure and some help, I think I can make it a little better. Your
Exactly.
your nice words, okay, but let me let me get some structure, get me some help, and I've seen on the news, about the traveling nurses, about how they go, and even the traveling nurses who are volunteering their time, they're getting pushback from. That makes no sense to me.
Right.
No sense to me at all. So I applaud you and all of those who do what you do, to keep this ship running, because this is not easy.
Absolutely not. Thank you.
Standing on the sidelines, you're right, you're in the game. I'm
Mm-hmm.
standing on the sidelines. It is not easy to even watch. Here's my other question for you. I have a 9 to 5.
Mm-hmm.
Your hours probably aren't what my hours are.
Right.
What does it look? So we're talking about a view from the nurses station.
Mm.
What does that world look like? It's aside from what it looked like post 2020,
Right.
pre 2020. Now that we're right here to think of it, what is that work schedule look like?
So most of us work 12-hour shifts, and full-time is considered 3 12-hour shifts. Part-time is 2 12-hour shifts, and I work part-time. I work Saturday and Sunday. And so we start at 7 a.m. And um, the interesting thing that I'm not sure if it'll come up, but I'll just say it now. The interesting thing is that with these patients, the whole idea, especially initially, was to minimize exposure. So, having said that, not a lot of people go into the room. They still don't. And so that means as the nurse, we are the nurse, we are ancillary staff, we're all the supportive staff, we are environmental sometimes, we are catering sometimes, we are all that to this patient. Also because for the most part, she's not allowed to have visitors or have anyone else in the room with her. So it's us.
Yeah. Yeah.
And so to when we start our shift, we have to give them breakfast. We have to bring their breakfast in. Whereas on a non-isolation unit, the catering staff will bring it in. So we have to bring them their breakfast. And what we try to do is we try to what they call consolidate care. So in the times that I'm in there, I try to do all the things that I need to do so that I'm not having to constantly keep going back and forth, because to get in the room is not just a knock on the door, hey, good morning, Miss Jones.
Right.
It is, we have to fully put on all our protective gear. So it takes about a good 10 minutes to get ready to go into the patient's room. And we do that at least 4 times during a 12-hour shift. And that sounds like a minimum amount, but that's just one patient. And that's 10 minutes per getting in, coming out, decontaminating, getting ready to go into the next patient room. And so we're doing that all the time. And then if they have additional concerns or medications or different things like that, then it's really, really, really challenging to manage them. And then somehow we get a break, and maybe we get to use the bathroom, and then stay, change our clothes, eat, sleep, shower, and then do it again the next day.
Wow. I actually have a question for you, but I'm going to read to you some of the comments that have been coming in. Thank you all for joining in. Thank you, Kiba, for joining in. Thank you, Pearl. Hello, Pearl. Hello, Arika. Hello, Shante. Let's see. Minister Johnson says, she said, wow, how does one manage symptoms and understand what is considered serious when sent home to manage those signs, indications, or issues? I'll get back to that question in just a moment.
Okay.
Thank you, Michelle, for watching. Hello, Cheryl Jenkins. Hello. Tangie, Pearl says, thank you for your service. Cheryl Jenkins says, God bless you. Arika says, praying for you and all the nurses. She says, thank you.
You ladies.
I'm going to get back to the question that was posed by Minister Johnson. She says, how does one monitor symptoms and understand what is considered serious when sent home to manage those signs, indications, or issues?
Okay.
And one more thing that Minister Johnson just said, this is not a question. She said, yes, God bless you all and the medical professions and the healthcare workers. Thank you, Minister Johnson, for that. But I'll leave you with that question.
Yes. So what we're asking is that if you're having a fever, persistent fever greater than 100.4, and when we say persistent means it's 100.4, I'm sorry. Am I saying it right? 100.4. And you take some Tylenol, it does not go away, or it comes back, or you keep having them consistently. You need to call your doctor first, or if you're not under the care of a doctor, then you will present to the emergency room. If you are having shortness of breath with just simple activities of living, like getting up and going to the restroom, where you can't even, and this is what we call extreme dyspnea. Like this is not just, oh, girl, I'm tired. This is, it's a progressive shortness of breath. Then that's a symptom that you should be seen for. If you're having, sometimes there's a cough related to it, but it's usually the fever and the shortness of breath are usually your sign. They're usually progressed to the point where you know that you have to be treated. If you're just having a little bit of shortness of breath, or your fever is able to be managed at home, then they're not asking you to come in.
Right. Because we have to keep in mind, there are colds that are still out here. There's still, the common cold. There's still other things. There's allergies. My goodness.
Yes.
Oh my goodness.
Yes.
So a lot of times we want to make sure that we're paying attention to the specifics. Like you said, a persistent fever that is 100.4, that is consistent, that is not, even though you take Tylenol, it doesn't go away, or it keeps coming back. Or like you said, the consistent shortness of breath where you know that this is not just, I'm gaining weight because I'm sitting up here eating all these COVID-19 snacks, but it's actually, this is cause for concern. There are other, we have to remember we're still living in the same world we're living in virtually, same world. So we have the same issues. Like we said, allergies, the common cold, the flu is still here. There are certain things that are still happening. So what I said all that to say, I don't want people to have your first thought to be, oh my gosh, I have it. When that might not be the case, because once you start believing it here, your body is going to line up. Something you said a moment ago, and thank you again, all those who have joined in. You gave like the outline of what a view from the nurse's station looks like as far as your 12-hour shift, which is wow, right? But something you said stood out to me. It's like one of those blue light specials, like really flashing. And that is, when you go to the hospital, you go to visit someone in the hospital, the nurse comes, knocks on the door, knock, knock, and come in like, how you doing, Miss Jones? But like you said, you have to go through a whole process. What if there's an emergency? What do you all do, rather, not what if? What do you all do if there's an emergency situation?
Right. Yeah, we talk about that all the time. So if there's an emergency situation, you just try to get in there as fast as you can and as safe as you can.
Yeah.
Fortunately, I don't work on a unit where I have to keep my N95 mask on, which is the respirator mask. I don't have to keep it on my entire shift. I do get a break from it, so that's great. But if for something, an emergency happens, like we monitor certain things at the desk, particularly her saturation level. And if her saturation level drops below the normal parameter, then we need to go into the room. And, just say an emergency does happen, we have to quickly try to get our mask on, try to get our protective equipment on to get into the room. At the very least, you want to have your mask on and some gloves. And sometimes that has happened, and we've just have kind of run in there and just try to get our stuff on. Hopefully by the time something really starts going down, you can get some support in there, and you can try to get somebody to tag you out, and you can try to get the rest of your equipment on.
Right.
But at the very least, we try to at least run in there with our respirator mask on and some gloves to try to get in there to work with mom. But it's that caregiver thing. I mean, we sometimes don't always always able to take care of ourselves properly because we're caring for others.
Wow, that actually leads into another question that I have up here, but I definitely want to say thank you. Goodness, thank you. I had to insert a thank you right there, because you really paint a picture of what, in my mind, it looked like. You are, as you said, you are the ultimate caregiver. As I said, I put on a hashtag in the promos, superheroes wear scrubs. And you guys definitely exemplify that. You guys definitely exemplify that. It segues into this question for you. Then I have another question for you, because you keep setting them up. I'm just like, oh, but Pearl asks, question for Tangie: what keeps you showing up?
Thank you, Pearl. Wow, that almost brings tears to my eyes. I keep showing up because I'm committed to what I do. At the end of the day, those of us that do show up, I feel like nursing is a calling, and we show up to do what we've been called to do. The things that we're struggling with don't really have a lot to do with the patients. And I say this every week. It's like, I can care for these patients all day long. I just need to make sure that I have the right support system in place to be able to do that, like you spoke about earlier. And so what keeps me showing up is that I know I'm called to this, probably about a month or so ago, the scripture in Esther came to me and said, who knows if you're not called for such a time as this? And, in my flesh, I want to like buck against that because I'm just like, but blah, blah, blah. But in the reality, I know that God has me here in this season for a reason. And that's just all. And so what keeps me showing up is know that I'm called to this. Does that mean that I'm not tired? Absolutely. Does that not mean that uh every day, every time I have to show up and care for these patients, I'm asking for additional strength. I'm asking God to be with me. I'm asking God, I always pray for my patients, but just help me, um it's just so many things about taking care of these patients that really wears on us. But at the end of the day, when I'm leaving my shift and I know that I've taken good care of my patient, she knows that I've taken good care of her. That allows me to show up again for the next shift.
That is awesome, and it absolutely shows. It shows. I'll get to my question in a moment, but we have some more that are coming up. Sonia Jordan, hello, Sonia Jordan. Absolutely. Um, and I know the answer to this first part, but I'm going to read the whole thing. Minister Johnson says, "Can you verify the temperature stated? Did she say 100.4? Yes, she did 100.4 or 104 before possibly returning back to the hospital." So she did say 100.4,
Yeah.
not 104. If you're at 104,
No, you're one for us. Yeah, yeah, we need to be doing some things immediately. Yeah, that's not okay.
yes, 100.4 consistently, or that does not, once you take
Not to breathe.
Tylenol, that it
Right.
does not make it go away. Am I correct?
Correct.
All right. And Cheryl Jenkins says, Amen. Hello, Cheryl. Oh my goodness. I'm so happy that you ladies are joining in and engaging, and asking some wonderful questions, because we definitely have a person here, an expert here, a Wonder Woman. You are an expert. You're an expert in what you do. You are expertly doing what you do.
Thank you so much.
And I'm sure if we ask any of your patients, they would say the same.
Thank
So
you.
my question goes back to something you said a moment ago, um, actually at the top, and that is about the patients. I asked a question about, what if there is. You're welcome, Minister Linda. I asked a question about if there's an emergency, and you said that you all monitor them, which is great. But where you are, they are at varying stages of pregnancy. They're not all in their ninth month. They're not all at delivery. Am I correct?
Correct.
Okay. And then, so like you said, some of them go home. So, when you think about maternal health, of course, the first thing that comes to mind is they're at the ninth month, they're dilating, they're getting ready to deliver. That's not the case, huh?
No, there's not. It's not. And again, they may, oh gosh. So we've had patients that have been with us about 3 weeks. There's two people that come to my mind in particular. These two ladies had 2 trips to the ICU. They were in like 30 to 32 weeks pregnant still, um, and had to be on a ventilator. So um, they're not all ready to deliver.
Right.
And at that time, we were concerned about, obviously, if mom doesn't have any oxygen, then baby's not going to get oxygen. And it's always mom first before baby. So, we are aggressively trying to keep mom alive. And we're also, monitoring the status of the baby. So they're not all delivered. And yeah, these moms, there are some moms that progress to the point they have to be in the ICU.
Gotcha, gotcha. And then earlier you said that 6 of the 18 patients that you recently were dealing had at that last weekend, right?
Mm-hmm.
So were COVID-19. But let's just take those 18 patients. Were all of them, or are all of them pregnant,
Yeah.
or do you have some that, okay, so all of them are pregnant?
Well, they're all pregnant or recently delivered with high risk conditions.
Gotcha. Okay. So recently delivered, we have some more questions. Recently delivered, and high risk after they deliver?
Yes, yes, because a woman is called the fourth trimester. So up until 6 weeks after she delivers, she's still at very high risk for a lot of problems. And so we take care of those moms, and whether it's related to her blood pressure or if she develops some kind of other illnesses or anything within that 6 week time frame, we take care of them as well.
I'm so glad that you said that because so often women think that once they, or people, because men as well, think
Uh-huh.
that after you have the baby, the hard part's over, but you literally are still open, you're still susceptible to so many things, infection and so many other things that yes, you had the baby, you push the baby out and the hard part is over, but you still have to heal. That's why there's a 6 week period of time
Mhm.
where if you, for me, my mother and grandmother, like, listen, you're not going anywhere. For me, it was
Right,
8 weeks. Listen,
right, right.
8 weeks, you shutting everything is down. You don't need to go anywhere. You're good. You and the baby, you're all right.
Mhm, mhm,
Because because they wanted to ensure that we were both healthy.
mhm.
And I remember, I can't remember if it was my mother, my grandmother, or my godmother. One of the matriarchs of my family said, the baby is fine. It's you that needs to heal,
Yeah,
right?
yeah,
Baby came out fine. It's you that needs to heal. So I'm
yeah.
glad you said that. So Erica has a question. Let me get the full question. She says, please tell me that you all are receiving, oh, I like this. Okay, I haven't got to the whole thing. Please tell me that you all are receiving extra compensation from your employers. They're giving everyone else bonuses, and you all are really on the front line. Thank you, Erica. Yes, they are definitely on the front line. And if they're not getting a bonus, they certainly deserve it.
Thank
Certainly
you.
deserve it.
So in all fairness to my employer, we're not getting a bonus. We do get an extra differential though for working, for caring for the patients. So and we didn't start off like that. It was about midway into caring for the patients that they recognized that and acknowledged that. And so we were happy about it. Of course, you have people who said it wasn't enough, but you know what? I appreciate it.
Wow, that's awesome. That is awesome. Pearl says she's asking to me, wow, and I'm with you on this, Pearl. She asks, are there any needs the public can help with? She says, I'm in tears over our presentation. Thank you so much, Pearl. I think that what we're doing now, informing people,
Absolutely.
education is key. I don't
Yeah.
care what it is.
Yes.
When we are informed, when we are educated on things, when we know how to handle things, before COVID-19, well, no, when COVID-19 first came into our view, we were told about the washing of our hands. We were told about, then it started with the washing of our hands, and then it progressed to a distance of 6 feet or more. Then
Mhm.
it progressed to wearing a face mask. Then it progressed, so we're learning, being educated along the way. We're
Yeah.
being educated on, of course, what I just did. Don't touch your face.
That's
Um,
right.
right. The things that if they started out with things that we had been told, to do to prevent the flu, to be honest with you. And
Absolutely.
then it escalated a little bit more and a little bit more. And so having forums like this where we can hear from someone who knows what it looks like, what it seems like, what it is,
Mhm.
being informed and being able to take the same information and tell other people or share it. If you don't remember it verbatim, just share. The good question that Minister Johnson asked. You wanted clarity. Is it 100.4? Is it 104? That's important to know. That's
Absolutely.
that's a very excellent question to ask.
Yes.
What is going on in my body that I need to be concerned about, or is it something that I maybe don't need to over, I don't, I need to be aware, but not scared.
Hmm.
Because fear has us sometimes to operate in a whole nother area that is not necessarily healthy. Being
Absolutely.
when you operate out of fear, you do things in a knee-jerk reaction.
Yes.
Whereas when you operate out of being educated, then okay, this is what I need to look out for. This is what this is what this looks like, and this is how I maintain my health.
Yes.
Because I'm looking at you and I'm so grateful because you, for the past 3 months, have been working in a situation as a RN where you are seeing people who are living their worst time,
Mm-hmm.
and you are looking amazing. I don't know your physical health, but if I had to do it from a view, God has graced you for this because you, like as you said, this is a calling, this is a ministry for you. This is not just an occupation. This is not, you didn't have to go to school for this, but you knew that this was something that you were called to do, and you went to school for it, and you got the education, the knowledge, and you have the heart and passion for it. And so I applaud you so much for that, and we here love you for that. We
Thank
really do.
Can I make a mention about, we talked
Please,
about symptoms, can we talk about asymptomatic, because that's what everybody's riding on now.
please, please.
So people are thinking if they're asymptomatic that they're good, right? And this is what we're trying to express to you, that even though you may be asymptomatic, you could still be a spreader or a super spreader. And you could pass it on to people who may have more progressive symptoms. And so there's a whole lot of information, and I won't get into the controversy of it all. There's a whole lot of information about, well, it doesn't take all of that, and we don't have to do all of that. But here's the thing, is that all we're asking is to do a simple intervention, and that's wear a mask. And so I'm not going to get into if the spores are small enough to get through the mask and this, that, and the other. Okay, that's whatever. But what we're saying is this: if you wear one and I wear one, then that minimizes the risk of transmission. That's all we're saying. So we're saying a simple intervention. We're not asking you to do anything more than that. If it doesn't work, there's no harm, But I think that right now people are riding on the asymptomatic nature of it, and they are probably unknowingly passing on this virus to people who are becoming symptomatic or who are presenting in different ways, that because probably about a month or so ago is when the loss of taste and smell came up. That wasn't one of the original symptoms. I know someone who, she had totally off atypical symptoms, and she progressed to needing care. And so it wasn't on the list. And what all we're asking is just do a simple intervention, and that's wear a mask, keep your space, and wash your hands. Like, how hard is that? This is a novel virus to us. We don't have the immunity for it. We haven't been exposed to it before. So what the fact, you don't know how your body's going to react when you are exposed to it. So do all you can to care for yourself. We're all tired. We all want to see our friends. We all want to do all the things, but this is a novel virus. And so we have not seen it before, and we need to take every precaution that we can to take care of ourselves, whether you feel sick or not, whether you have a fever or not.
Right.
You might spread it to mama, and mama may have to get intubated. And so I would hate to be that person, that spread it. And then it's just a slap in our face to those of us who every weekend for 3 months, I am taking care of these patients who, like, the biggest thing I've been hearing recently is, I don't know how I got it. Okay, so what were you doing? Oh, we just had a graduation. Oh, we just did this, but none of them had symptoms. Okay, you know what I mean? And it's just like one of my friends said, it's just like having unprotected sex and don't know how you got pregnant. I don't know, it didn't seem like it. And I can get on a whole soapbox about it, but all I'm asking is just to take proper precautions, because what's happening is that the healthcare system is overwhelmed, and where it may not have been a terrible case because we can't properly get to you and get you the treatment you need, then it progresses, and we don't know the long-term effects of this virus. So just
Right.
do due diligence, please.
Absolutely. Oh my goodness. You said a couple of, telling you just set them up and I just have to come in. Oh my goodness. I love what Melanie said. Melanie says, you don't look like what you've been through. I love
Thanks, girl.
Someone says, yes, wear your mask. Yes, indeed. Just over this weekend, I personally hadn't seen my parents physically. I mean, since the beginning of the year. So what we did was exactly and it was different, but it was doable.
Mm-hmm.
We surprised them, and we stayed probably more than 6 feet away from them. Everybody wore a mask. And there was actually, I never touched anything. I didn't touch when we went in. I we first went to my father's house, and I pulled into his driveway. He had no idea I was on the phone with him, and I distracted him, so that's how he didn't see me. And I told him to come out to his garage. I stayed in my car until he came out, but my daughter had gone up to. He has these what do you call it? It's like a mesh covering for his garage. So she was still maybe 8 feet away from him. And so I said, his wife said, you all can go inside and social distance in his man cave. There's plenty of room in his man cave. And so I said, okay, Daddy, you go in first, and then we'll go in and go to our where we're going. So we're spread out, and it was perfect. It was weird. You're used to hugging your loved ones.
Yes.
But at the same time, we wore our masks, but it was fun. It was something different. Father's Day 2020, something different. We did the exact same thing for my mother and my stepfather. He had no idea. It's funny, you get them on the phone, they get distracted. So they didn't see us coming in. But the same thing, I said, go to your front door. And then, they saw us, and we put on our masks. And the same thing, we were able to social distance. We actually went out into the yard. We stayed out in the yard. My mom was showing me, her plants and things, and it was great. And we went home, and so we had to do something different.
Yeah, sure.
But we had to stay healthy. I love them. I love them dearly, and that's why, there was no contact. It was because I love them, and like you said, do the necessary. You said something a moment ago that I would like, and I'm interested in. Now we know about being a carrier. We know, well, I believe, I don't want to assume, but what's a super sharer?
Super spreader is someone who has a lot of frequent contact with individuals. So technically, I could be considered a super spreader because I'm a nurse and I have a lot of contact with sick individuals.
I see.
So I think I heard of a story recently where there was a bachelorette party, 12 people, all 12 were diagnosed, were positive. So somebody possibly could have been a super spreader in that group, So,
and that's the thing, but being asymptomatic is you don't know. It's pretty much like even the flu. I remember being at my job a few years ago, and the person who was actually spreading it, their child had the flu. They were fine. Their child had the flu. They were fine.
Right.
Came to work, and several people. It was like dominoes.
Yes.
It was like dominoes. It was the craziest thing. But that person never got sick. And so we don't know, we want to get together. We want to, Memorial Day was a classic example.
Yes.
Classic example, the first holiday of the summer. People want to, have some normalcy. I get that.
I get it.
But, being on a ventilator is not normal.
It's not normal. And here's the other thing. People are like, even some of my coworkers have said this because I think they're sending more out of fatigue, but some people are just like, well, if I get it, I get it. No,
oh, wow.
I'm not interested in getting it, because we don't know how my body will respond to it.
Right.
And so people are just nonchalant. There is such a thing called, I'm sure you know about this, herd immunity. And so people who are, there's the phenomena is that you get it, I get it. It's kind of like what you do when your kids have chicken pox. You put them all in the same room so everybody get it. So that's herd immunity. And so everybody gets immune that way. And so there's a theory out about herd immunity. And so let's all just get out and get it. Give it to each other. Let's all get it. But here's the thing is that this is not the flu. Even though there are more people still die from the flu, but this is different. This is novel to us. And so I'm not interested in herd immunity. No. I'm not interested in just, taking my chances. None of that.
Especially when we have seen proof after proof, test after test, we've seen statistic after statistic that the the Black and Brown communities are affected substantially differently. And when I say and I changed what I said, I was about to say, because I was about to say African American, but it's the Black and brown,
Yeah.
which includes the Black, Hispanic, and Native American
Yes.
sisters and brothers, that it's affecting exponentially differently
Yes.
than our counterparts. And I don't think that people are getting it. I know that we love to have family get-togethers. I know that we love to spend time with loved ones, and I know that we like to say, "Well, I'm fine. I've been tested." Okay,
Mhm.
you were
Yeah.
tested then.
Uh-huh. Yes.
You were
And
tested then.
there's a lot of false positives, false negatives.
Right.
I've taken care of patients who tested negative and then turn around and tested positive during their stay, and vice versa. So there's like, right now it's still just new. Let's just do due diligence. And I want to, we know about health disparities between non-white and white communities. We understand that. So that's not a new
Right.
phenomenon. But
Right.
this is something my coworker, this is like a low-key study I've been doing because I take care of a lot of minority patients, right? And I
Okay.
was like, what's different? What are we doing different? And even in my personal study, I want to know why black women are dying more, right? But in particular with COVID-19, and I'm starting to, when I'm interviewing these patients, I'm starting to understand it's the culture of what is being disseminated among the community.
I love
And
it.
we can
Talk about it.
thank social media for that.
Yeah.
I love social media, but that's part of the problem. But we have circulated so many false rumors about how it affects our community
Right.
that we literally do not heed to a lot of the advice because we think it's a conspiracy, that we can't get it, that they just trying to do X, Y, and Z. And that, you know, that's not altogether true.
Right.
And so
But
I
here's
took
the
care of a
thing.
patient. I'm sorry.
Here's the thing. What if it is? Let's just say all of it's true.
Right.
That should make you want to adhere to
Exactly.
more.
Yeah.
Like, seriously, if you like you said, some of the posts on social media, my goodness, well, if that's your feeling, then hello, knock knock, you might want to start wearing a mask, washing your hands, and socially distancing
Mm-hmm.
even more.
Mm-hmm. Mm-hmm.
But except for the ones who just flat out just don't believe.
Just don't believe. Yeah. And I think too, like with most things, if someone is not close to us, if it doesn't touch us, then we think it's them or it's over there.
Right.
And honestly, before I really start taking care of it, when it first came to our area, I was in an outpatient setting, and so it was kind of a cursory experience I had with it. And we were just getting a test, and if you were symptomatic, go to the hospital. And so it was still all kind of woo and ethereal, right? But then when I had to gown up weekend after weekend after weekend after weekend, and I'm seeing these patients that are not getting well, I'm not used to taking care of patients that don't get well. My patients have a problem, they have a baby, and then they go home. You know what I mean? And so when I'm seeing these women that I'm taking care of for 3 and 4 weeks who've been on ventilator twice and different things like that, and they're still pregnant, I'm like, wait a minute, like this thing is real. And so I think because it's not, if it hadn't hit our home, then we are a little bit more, you know, lax about it. But I just want to sound the alarm and let people know that this is not a game. It's not a conspiracy. We are getting sick and we are not doing well at the same time.
I appreciate you so much for saying that, though exactly the way that you said it. Exactly the way that you said it. As we're wrapping up, I do want to ask you, um, uh, have you seen, I know we talked about Memorial Day, and of course, after that, we had the protests, and we had,
Mhm.
people who, the state of Georgia specifically, has opened up a little bit more, a little bit more, a little bit more, and they're talking about the numbers up and down. And your experience over these past 30 days,
Mhm.
I'm not even gonna go back 3 months, past 30 days. Have you seen the numbers increase, decrease, or stay the same?
They have definitely increased. They have definitely increased. Um, and we know there's a 14-day incubation period. And so, um, how it's, maternity is always feast or famine. But what I can say though is that we are seeing a definite increase in the rise of diagnosis. I mean, you know, there's a conspiracy like, well, we're testing more, so that's why we're seeing more. Maybe, maybe, maybe. But what I'm saying is that we also are seeing an increase in symptomatic patients. So
Right, right,
that's a concern.
right, right. As we're closing up, thank you, Nelva, for joining in. Thank you, Tracy, for joining in. If you all have any questions for our lovely guest, Miss Tangie Henry, RN, if you have any questions or any comments, if you want to leave her some encouragement, please feel free to do so now. As we're getting ready to wrap up, I tell you what, Tangie, you have been such a blessing to be on here, just to hear from you. Like I said, a view from the nurses station. We see the news, or many of us who try to stay away from the news, we see social media or whatever, but we don't get a chance to hear the heart of you guys are the heartbeat of what's going on.
Mhm.
You guys are the heartbeat of how these people are recovering, how they're going through their sickest time. As you said, this is a novel virus. That it is the novel coronavirus. It is new, and as you said, this is we're learning as we go.
Mhm.
And a lot of what you said touches so much, because there's no, when we talk about the typical patient. There is no typical patient. We know that it affects our elderly. We know that there is now a strain where children have a respiratory distress that is now being presented. But there's no, oh, he was, a senior citizen, so it affected him, or
Right.
she was a senior citizen, so it affected. No, you have you have women who are in childbearing age, who are varying ages. You are seeing patients who are not fitting the demographic.
Right. Right.
They're not fitting the demographic that's being purported on TV.
Right. And I read a study just recently is that the highest number of cases are young adults. And so these are typically asymptomatic ones. But you know that these are typically asymptomatic that possibly spread it, but these are also ones that are getting sick. So it's not just for just the elderly or immunocompromised or pre-existing conditions. Of course, that puts them at greater risk. But these are regular athletes and people who are being susceptible to this virus. And so it's not to create fear, but like you said, it's to create education. And so we need time. We need time to get a standard treatment plan. We need time to find out what's going to work to help these patients. But in the meantime, can we please just wear a mask and keep our space and wash our hands? That's all we're asking.
Yes, thank you for that. Thank you. Thank you. So, Summer Wesley says, thank you so much, Tangie. Michelle Rogers says, thank you so much for your continued service. We know it's not easy. Minister Johnson said, wonderful discussion. Thank you, Nurse Tangie. And she says, thank you to me. I am so appreciative to you, and for all those who are tuned in. Oh my goodness, this was a great discussion.
Thank you so much.
Great discussion. You've helped to dispel some myths. You've helped us to get clarity. You've helped us to put a human side to what you do, because it's not, they're nurses. That's what they're supposed to do. Well, they're human.
Mm.
With homes and lives outside of the hospital or the clinic or the facility that they work in.
Absolutely.
So I appreciate you for everything that you do. As I said, superheroes wear scrubs.
Thank
So,
you.
and you are definitely that superhero. I thank you for shining a light on things that we may not have known. Sometimes we glance over or gloss over.
Mhm.
We've gotten so much information, um, but you were able to make it clear. You were able to make it human for us.
Thank you.
Sometimes we get so much information, we disconnect, and maybe that's part of why people aren't really getting it, because sometimes we get inundated with so much,
Absolutely.
we
Absolutely.
disconnect. And so you definitely allowed us the opportunity to connect and put a human side to it. You gave us your wisdom, and you shared it with a heart of passion and compassion, which only shows us what it's like for your patients inside the room. For them, when they see your smiling eyes, because I'm sure they can't see the other in your eyes.
That's our little joke. Learn how to smile with your eyes.
Smile with your eyes. um, and just you've given us perspective. You've given us perspective, about a population that we're not even thinking about. These women, what should be their most joyous time of their lives, in delivering their newborn, or preparing to deliver their newborn, or preparing to take their newborn home.
Yes.
There's that demographic that we're not even talking about.
Right.
Um, and you've given us, great insight and great wisdom, and I just truly appreciate you. As we're closing out, I want you to tell us about your platform. Now we're gonna separate Tangie Henry RN, and we're gonna plug in Tangie Henry, the Inspired Sister. Tell us a little about Inspired Sister.
Sorry, raining really hard here. Sorry. So I just want to say that it took me a long time to really come to grips that Tangie Henry RN and Tangie Henry Inspired Sister are the same person. I've been called to do a lot of many different things, and God says, whatever I call you to do at that moment, you do it. And so in 2010, I started Inspired Sister, which is a platform to help women live healthy from the inside out. And additionally, under that umbrella is Healthy Sisters Rock, which is a part physical, a lot of emotional work that goes into a woman being healthy wholeheartedly. And so I'm on social media platforms as Inspired Sister, that's Inspired, Sistah, or my name, Tangie Henry. I'm currently about 2 to 3 semesters away, depending on the pandemic, from getting my nurse practitioner degree, so that I can serve women in a greater platform. I really want to position myself educationally to do preventive measures because we are so disproportionately affected. I want women to have the tools and the education to take better care of ourselves so that we can go on and continue to do the amazing things that we've been called to do. And I want them to see it in me first. And so my life is a continual work in progress, and I share a lot of things on social media so that you can see that it's no superhero feat, in that every day I have to show up for myself. And so I do that through many different ways. But Inspired is all under the umbrella of Inspired Sister. And I'm on every social media platform as that, or inspiredsister.com.
Excellent. And I just put it on Facebook as well for people who want to follow you on here. And you said your website. Let me put that on here as well. So your website is inspiredsister.com.
Yes.
Okay.
Yes. Sistah.
Oh, I got that. I definitely got that. .com. Excellent, excellent, excellent. As we're closing out, Tangie, is there anything, that you want to, any closing words that you want to leave with the ladies that are joined
I'll just thank you, ladies, for joining us. And I just want to say, just keep us in your prayers, like sincerely. We were just discussing it this weekend. We was like, at first, just like everything else, we were getting lunches and we were getting all these accolades. And now it's like, oh, we've moved on. But the fight still continues, and we need your prayers. We need the strength to be able to show up and serve. So that's what we're asking for. Lunches are great. We take those too. But what we really need is for you guys to continue to pray and also keep yourselves healthy so that we are not overwhelmed and overburdened, and so that we can really serve those that are sickest. So please take care of yourself as well.
Absolutely. Words literally to live by. Thank you so much, Tangie, for joining us. Thank you, ladies who are on now, and gentlemen. I don't want to discriminate. Ladies who have joined in. Listen, we are glad that you all have joined in and been a part of this discussion. Everyone that made a comment, that said some Wonderful comments. Jordan said, awesome and inspiring. Minister Linda said, thank you, Tangie, for being a great inspiration to her daughter. Wonderful. Wow. And she said, God bless and praying. Oh, that's beautiful. Linda Williams said that. I apologize. It wasn't Linda John. Linda Williams said, thank you, Tangie, for being a great inspiration to my daughter. That's
Oh, thank
beautiful.
you.
Linda Johnson said, God bless and praying. That is beautiful.
Thank you.
Absolutely beautiful. I invite you guys out as we're closing out. I invite you guys to join us on next week and every Monday night, 7 o'clock p.m., where we'll have discussions just like this one. It's a different topic every week. Next week, you don't want to miss it. And this definitely, I won't forget to mention the men because it's going to be about men. The title is going to be Men and the Myth Behind Mental Health. So we're going to be really talking to the men on next week and the women that love them. And we're going to be joined by Dr. Brian Jones, LPC of Joshua Generation Consulting Services. He is an excellent mental health provider, and he is going to come in and just lay it out as it should be. He no holds barred. He says it like it is, and we're going to have it. We're going to accept it and be happy about it because he really loves and it just like you, Tangie, he loves what he does. He's a minister of the gospel as well as being a mental health therapist. And so he knows he's seen both sides of the coin. Just as you serve your patients there in the hospital and serve as an inspired sister, you serve and a child of God, you serve your purpose well. And so on next week, 7 o'clock p.m., we'll be right here. Men and the Myth of Mental Health will be right here. Thank you all for joining us here on the PAYNE in the Pews Mental Health and Ministry broadcast. Again, I am Chelselia Cookie Payne. If you're not already a part of our group, PAYNE in the Pews PAYNE in the Pews, that's our group page. Feel free to go on over after this webinar and go on over and join us there. PAYNE in the Pews is the group page. Of course, you can follow us PAYNE Glory on all our social media platforms, which is PAYNE Glory, and you'll see all of our upcoming events. Our next major event, which will be our conference, which will be held in September 18th and 19th. It will be virtual this year. We're going to have, just like it was in person, we're going to have a wonderful revival service, a restoration service on September the 18th featuring Dr. LaTanya Powers. You don't want to miss that. It's going to be on the 18th, and then on the 19th, we're going to have special guests, mental health professionals and ministers that are going to be on a platform that is going to be right here live just for you. So you can join from wherever you are. You'll see more information about that coming up. Again, Tangie, thank you so much.
Thank you for having me.
Heroes do wear scrubs. Thank you for giving us a view from the nurses station. Thank you so much.